invitation to moderate this star-studded panel. All of our speakers have just been introduced, and so we'll get right to it. Just a few ground rules. Each speaker, please limit your opening remarks to about 3 minutes. So hopefully we would get a little bit of a chance to address some of the questions or comments from the chat box. So for all the participants, please type your comments or questions in the chat box, and I will try to get through as many as time allows. Now, this panel is really about learning from each other. The national laboratories and the populations in different contexts have learned different lessons. And therefore, we focus on 3 questions and pose them to our distinguished panel. First, what has been or is the role of science in your country? And secondly, how has research featured in fighting the COVID pandemic? And in your view, having learned some of those lessons, how we should use research to fight future pandemics? And finally, not least, the EDI question, that is about equity, diversity, and inclusion, something that Joe Stiglitz spoke very passionately about at the beginning of this particular meeting. So with that, I will first pass the floor to Marco and then to George Gao. So Marco, over to you, please.
Okay, first of all, I would like to thanks for the invitation to be here and to present some of the activities that was done to face the pandemic in Brazil by our Institute Oswaldo Cruz Foundation. So I think it's important to say that Oswaldo Cruz Foundation have a complex ecosystem that came from the basic research until the production of medicine, vaccines, and also we have some hospitals inside Oswaldo Cruz Foundation. So we have a lot of activities to help the Brazilian society to face the pandemics. I can highlight, for instance, in terms of the diagnostic support, we do the production of molecular tests, rapid tests, and also to perform the testing. The numbers are something like 100 million tests was produced by the Oswaldo Cruz Foundation. Also, with a partnership with AstraZeneca, we are doing the production in Brazil of the Oxford AstraZeneca vaccine. And last year, we were able to deliver to the Brazilian society 150 million doses. That was really important for us to face the pandemics. But in terms of the research, I think we are learning that we need to try to integrate a new way of surveillance in our ecosystem. So an additional challenge was to try to connect the information that we have from the traditional surveillance, try to put the new information that we receive, for instance, for the massive sequence of the virus in Brazil. So we are working since February of 2020 in the genomic surveillance of SARS-CoV-2 in Brazil, including the variant of concerns. And this is important that we were able to connect and integrate this information of the genomic dynamics of the virus in Brazil with the dynamics of the pandemics. For instance, we were able to evaluate the impact of the genomic variants in the Brazilian public health system. The evaluation of the hospitalization and intensive care beds was done, and we can, in this way, we can show that the Brazilian situation moves according to the different variants. For instance, the variant Gamma was really a big issue for us in the beginning of last years, and also using this big data correlation of our public health system with the genomic information and the the vaccination in Brazil, we were able to see that other variants was not so bad as Gamma because we have really an impact of the vaccination in our population. And another important area that we are trying to working now is trying to have a kind of immunological surveillance. So we are trying to evaluate the impact of the genetic variant of the virus with the vaccine protection, for instance. So it's important to say that every new variant we need to evaluate.
Brazil for that intervention. Now over to George, Professor George Gao from the China CDC.
Hi, everyone. Hi, Gabriel. Thank you. So obviously you raised three questions. I will go one by one. The first, what's the role of the science for, the control strategies for the COVID-19? And of course, the role of science is clear, is there. For example, the isolation of the virus, it must be science-based, and sequencing and the vaccine development. More importantly, in addition to the science, would help for the measures of the COVID-19 control. It also expand further. For example, because of the COVID-19, though we are having the problem with the pandemic, but this time it provides a very good chance to put the mRNA technology into the healthy population. That's very important. Foresee the future, mRNA science, mRNA technology will help us to promote more research for the science, especially for the mRNA technology. That will help us to solve some problem like genetic disorder, cancer and tumors, and metabolic diseases, and maybe autoimmune diseases. So, for example, in China at the moment, we are running a zero COVID strategy. So everything is based on science. We need sequencing. We almost sequencing any source from a very beginning. We know, what kind of variants we have, and we know the source where the, and then we know, then we will introduce our strategy. So science plays a very, very important role. And here, for the COVID-19 control strategy, especially China is running a zero COVID strategy. And the second question, what research and what lessons we learn, from this COVID-19. From this COVID-19 pandemic, I think, we need to learn a lot. For example, for how can we really collaborate each other for the research, for the origin of the virus, and for the PCR-based diagnostic kits from the very beginning. How can we share everything, and how can we organize an international group to work together? All these are the lessons we should learn. And for the future, we might encounter another outbreak or even another pandemic. That's for sure, because Omicron here, we have another new variant, and also we might have another recombinant virus. At the moment, all the viruses, they are point mutation variants. We haven't got a recombined coronavirus, but coronavirus is characterized by the recombination. One day we will have this. For this, we should learn or do more and more sequencing work. So for that, at the moment, we have a GISA for the data sharing, but we still need a kind of a coordinated work to work together to try to, push very hard to, get a very short period of time to get the real sequence there. For the last question, inequality or, inequity. And this is very important. We need something because the, economic development stage in the different countries, and because of the capacity, both in terms of the, hardware and also software. I call it software, soft stuff. It's professionals from different countries. We are so different, and in China, For example, in different regions, for the zero COVID strategy, Shanghai is doing very well, but we have some other regions, and it's not really equal like we did there, because we need more professionals to be trained. So in general, I think science and technology have been play a very important roles for the controlling of the COVID, and we should keep asking all the answers from the science and technology. Thank you. That's my open address.
Thank you so much for that intervention, George Gao from China CDC. Now we move on to from the Nigerian Center for Disease Control and Prevention, Dr. Additiva.
Thank you very much. I'll start off by, to thank and acknowledge WHO for the work that you do to help assure global health security. It's in 3 days' time, it will be exactly, 2 years since we first detected the SARS-CoV-2 virus in country. And since then, our capacity to generate evidence to inform our response has increased. Some of the areas where this has been brought to bear, of course, is in the area of genomics. A lot has been said about that by other speakers, but I think for emerging pathogens like this and for the future, it is important for us to be able to generate evidence through genomic surveillance to look at mutations and all the other factors that are required to ensure that we can track emerging threats. In addition, we conducted, as recommended by WHO, used the risk analysis approach to inform our travel advisories and policies. We used, initially, given the difference in the trajectory between SARS-CoV-2 and COVID.
Eu gostaria também de fazer rápido comentário aqui, né? Primeiro, salientar, dar parabéns ao Pedro, a todos os colaboradores lá, porque eles...
Yeah, there we go. Yes.
It was our serological studies were the first to give us an inkling into how widespread transmission of this virus was in the population, and therefore informed our need to urgently ramp up testing in the population to give a better sense of the burden of disease and burden of infection. Obviously, we also adopted evidence-based interventions in the area of public health safety measures, and also took on board evidence generated to improve case management, including the new drugs, dexamethasone and the like that came out of Solidarity trials. We adopted science to validate assays for use, including testing assays that were generated in country for their performance in and potential for use in the response. And of course, we took on board credible guidance based on evidence collected by the WHO and recommended for our use. In terms of what research has been important and lessons that have been learned, I think obviously a lot has been said about equity, what equity in access to vaccine, or equity in even the ability to bring on board modern methods or novel techniques for manufacturing. And one other area of inequity, obviously, is the access to funding for research, and the fact that many countries, including ours, had to invest in focus on investing in the response, giving challenges of resilience that are historical, rather than actually being able to spend as much funding as research required. The other thing, of course, is in the context of the pandemic, rapidly evolving situation, one lesson learned was the need to find more rapid mechanisms down from proposal writing to ethical approvals to make sure that we were a bit more nimble in being able to carry out studies and generate data. While you had cases, for example, during waves, and rather not waiting till the end or in between waves, as the case may be. I think in general, we've all learned that a lot more investment is required in the research ecosystem. We need to do that in less resource countries to, of course, contribute to our self-reliance, our ability to generate new products, to advance our research and development, which of course will contribute to economic development, but also ensure that we have more resilience to look after problems that may emerge or problems that may affect us either directly or, of course, in the course or as part of a pandemic. In terms of the question around inequity, well, we have a practice of, well, we recognize, first of all, the need to do things at scale. We're a large country in terms of, well, not like China, but in the continent, we are 200 million people scattered in 37 states, which are almost like different countries themselves. And we quickly recognize that we will only be as strong as our weakest link. So our research approach to research is to ensure that we have representation to the extent that it's possible, so that you generate evidence that is sufficiently representative to inform policy. Of course, in terms of addressing equity, there's a recognition of how the pandemic or outbreaks affect people really in an uneven manner. And this highlights the need for governments, obviously, to put in place social support measures as part of response, and even to conduct more research into what are the better options or the best ways to intervene in that space to mitigate the non-health impact of disease outbreaks or pandemics, as the case may be. Finally, we continue to conduct regular and frequent perception polls in the country, which have been very useful in helping us to guide our risk communication and to ensure that the messages that we craft or push out, or that we need to adapt, actually are suitable to the for the needs of all of the various population segments in the country. Thank you very much.
Thank you so much, Dr. Adetiva. Now we move on to Japan with an intervention from my old friend, Dr. Hitoshi Oshitani. Hitoshi, over to you, please.
Thank you, Gabriel, for introduction. It's my pleasure to share our experience in Japan. Actually, in Japan, we have been implementing a quite unique approach for COVID-19. By understanding the importance of the cluster or super spreading event, we've been implementing the cluster-based approach, including the retrospective contact tracing. And also by understanding the importance of aerosol transmission from the beginning, we've been advocating the concept called 3 Cs, the closed environment, crowded condition, and the close contact setting as the important the risk factor for environmental risk factor for transmission. And it has not been easy to implement science-based strategies. And all these our strategies are based on the scientific evidence obtained from our research. But it has not been easy to implement the science-based strategies. There have been always some tensions or the conflict between scientists and the policy makers. The situation is becoming even more complicated with a prolonged pandemic that has lasted more than 2 years now. There are a lot of pressure from the business communities and also from the general public to relax control measures. We also need to adjust our strategies to the new variant with different characteristics. Communicating the evolving strategy is also the big challenge for us. We also have the highly aging population, as you know. Many elderly people have died from COVID-19, and many of them were living in long-term care facilities. How to protect them is a critical research question in Japan, as well as many other countries. And as we have learned from previous sessions, a lot of research have been done in the past 2 years at the unprecedented scale. But despite such progress, the pandemic still continues and continues to kill many people every day. And we are now facing many challenges that the basic science alone cannot answer. we need to consider many different aspects, such as cultural, the social, and the psychological aspect in implementing the various control measures. And we also need the social science approach to access the underserved population. And I believe that we need more the interdisciplinary research involving a different the aspect. Thank you very much.
Thank you so much, Hitoshi. Now we move to the Republic of Korea from KCDC. Hee-Chang, are you ready? Over to you, please.
Thank you for introduction. I will also answer the question one by one. The first question, what has been the role of science in informing COVID-19 pandemic control measures? As already pointed out by other presentations in this forum, advances in science have made it possible to quickly identify and share the appearance of new mutations, I think, which has been a great help in responding to pandemic. As a recent example in Korea, from the day of Omicron variant was designated as a VOC by WHO, quarantine and social distancing were strengthened in Korea to slow the prevalence of Omicron variant in Korea. Through this action, the dominance of Omicron variant in Korea was delayed by 2 months compared to other countries, so that the Omicron mutation did not become prevalent at the same time as with the Delta variant. So during that 2 months, the number of critically ill cases due to Delta variant outbreak has decreased. So there is room in intensive care unit. Moreover, the third dose of COVID-19 vaccination for high-risk group was completed in Korea, and a therapeutic agent, for example, Paxlovid, was introduced and prepared for the treatment. So as a result of these responses, Korea still has a low cumulative mortality rate despite Omicron pandemic. As well as these actions, Korea also developed own monoclonal antibodies named Recurona, and we used more than 50,000 patients, and we also developing our own vaccines. There is science in drug discovery, science and technology, information and communication has been actively used in Korea for quarantine and patient care. As in other countries, information and communication technologies such as QR codes and non-face-to-face treatment system through video and phone have also contributed greatly to the implication of quarantine policies and treatment. And number two question, what research has been important and what lessons can we learn to prepare for future pandemics? I want to just introduce Korean experience that Korea experienced the Middle East respiratory syndrome outbreak in 2015. And at this time, we signed an MOU with the US NIH and gained experience while jointly developing an antibody treatment for the MERS with US. In this COVID-19 outbreak, the National Institute of Infectious Diseases, actually I'm a director of the institute, affiliated with the Korea CDC and Korea NIH, developed a monoclonal antibody with the Celtrion company Korea and obtained a joint